Hello, everyone. This is Dr. Melany J. Silas, and I'm here to give you some mental health tips as we navigate this COVID-19 shutdown. Over the last 2 weeks, our homes have become not only our places of sanctuary, a place of rest and respite, but it has also become the places in which we work and in which our students or our kids actually have school. And so I want to give you some helpful hints in terms of trying to reacclimate yourself or recalibrate yourself to this new routine. Without having to go to work and going to school outside of our homes, we are forced to actually create new schedules for ourselves. So, creating a schedule, time to get up, time to go to bed, breakfast, lunch, dinner, snacks in between, creating a schedule will help us to kind of keep the anxiety down a bit. Creating a schedule gives us structure, it helps us to stay organized, it helps us to stay on track. Provide getting putting together a to-do list and things that need to be done and when they need to be done is always helpful. And sometimes when we're in the house and we're working and they're doing schoolwork online, it can get a little, taxing, mentally. Make sure that as you're doing your work and as your kids are going to school at home, that you also plan time for family time, that you also plan time for your own self-care. Make things fun, create things that you can do in the house to help you to deal with being inside for a long period of time. So here are just some helpful hints or some tips or things that I've seen other people do, which is absolutely amazing. Some people are baking. Pick a different pastry, pick a different dessert, pick a different dish that you can bake. Do things from scratch. My grandmother always used to bake things from scratch. And so sometimes we're in the hustle and bustle of, our everyday routine. We don't always get a chance to, do what grandma used to do and make our own dough or make our own pasta or, create a pie from scratch and baking. So this gives us an opportunity to do that. Cook a new dish. My sister Mika has been doing these phenomenal dishes like every day. Like every day she has a new dish that she's cooking and she's incorporating her girls. She has 3 girls, and they range from different ages, but she incorporates them into that process of cooking and baking so that she can not only engage her own senses, but her daughters as well. Take a walk outside. I think that it's important during this time that even though we're on shutdown for the most part, that we are also engaging in fresh air, that we are walking, that we're still doing our social distancing, but we are taking care of our minds and that we need that sunlight, we need that fresh air, that breeze, we need our bodies to stay active. My daughter wanted to go walking the other day and she almost wore me all the way out just with walking alone, but it was good for her, it was good for me, and I think it's something that we're certainly going to be doing more often. Read books. Have a book group like within your household. Read to one another. Read on your own. Become a part of a book club virtually, or do phone conferencing. But reading is always good. Engage in science experiments. I know that our wonderful mayor and her daughter are doing science experiments at home. And so it's an opportunity for us to take her lead to do some science experiments as well. Board games, board games, board games. If you have a ton of board games at home or even a few, take a few and have a game night. Maybe your family game night has kind of fell to the wayside because everybody's been busy and everybody's got different schedules. This is an opportunity for you to re-engage that. Definitely talk to your family members and your friends virtually. Mental health definitely does do wonders for us, or that it is better when we engage with people. And since we can't be with each other physically, we can certainly try to connect with one another via phone calls and virtually. Have a movie night. If you have a partner or a significant other, you can create a date night at home. My sister Trina just told me that she rearranged the furniture in the house and created a date night for her and her husband, my brother. So that's always a great idea. Create dance contests between you and the people in your home. Log on to virtual exercise modalities, line dancing, meditation, yoga, spiritual services, devotion, prayer lines, things of that nature. All of these things are wonderful ways in which we can re-engage. We can let out stress. We can allow our minds to take it off of COVID-19, allow our minds to kind of, to just take a break. If you are an artist, play instruments, draw, do poetry, create other games in the house. There are so many things that we can do. I think that, at the bottom line of this really is to take this opportunity to be creative and to really create your own peace and your own joy. And I think that's really important when we're in stressful situations. I think that, what someone else does may not be a benefit for what we might need. So we have to create those spaces and create those things that give us what we need, that give us that peace, that give us that joy, that fills our cup, so to speak. So in order to figure out what that is, we have to try different things. So don't be afraid to try something new. Before I leave, I would like to share with you some general numbers that could be helpful in terms of also managing our mental health. Sometimes meditation doesn't do it. Sometimes when we light our candles and take our long baths or long showers or have our own spa days, there are still gaps that we still need to attend to with our mental health. I'm going to provide you with some national, state, county, and local numbers to deal with mental health. On a national level, I'm going to start with psychologytoday.com. It is a national website that allows you to search for counselors in your area. So if you are in search of a counselor, you can go on psychologytoday.com and you can click on Rochester, like the New York area, and then Rochester, and then it will provide for you all of the counselors who are available or who are in the Rochester area that you can research and get in contact with. In terms of other national numbers, suicide hotline and the Veterans Crisis Hotline, that number is 1-800-273-8255. Again, that number is 1-800-273-8255. When we roll over into New York State, the Office of Mental Health, that number is 1-844-863-9314. Again, that number is 1-844-863-9314. And then we roll over to the Monroe County. The Monroe County Office of Mental Health, if you go to their website, monroecounty.gov, and then click on mental health, they have a plethora of resources. And it also lists some different organizations within our own community that will be helpful with dealing with mental health. Their number is 585-753-5530, 585-753-5530. And then Monroe County Domestic Violence Hotline is 585-428-2215. Monroe County Domestic Violence Hotline is 585-428-2215. And the last local number that I want to share is our Lifeline mobile crisis team here in Rochester. And that number is 585-275-5151, 585-275-5151. I mentioned before at our town hall meeting earlier today that, COVID is definitely something that has, really come upon us quickly. But people were already dealing with stress and anxiety and feeling overwhelmed and, and being taxed, so much just in their everyday life. And I think that with all that is going on, this shutdown gives us an opportunity to stop. to just be, to really reflect on where we are, who we are, where we want to be. It's a wonderful time to recalibrate your mind and your spirit. If we were tired going into COVID-19, we certainly don't want to still be tired when the shutdown is over. When the shutdown is over, we want to be our very best selves. And so I encourage you, even though I gave you a ton of tips on how you and your children or your family could engage in certain ways, I implore you, to be intentional about your downtime, to be intentional about being still, to be intentional about using this season to recreate yourselves in ways that are more healthy, to engage in healthy activities so that those particular practices can be something that you do more regularly, even when COVID-19 is over. So I wish you well in your mental health and your journey. I hope that you are all doing well spiritually, emotionally, mentally, that your anxiety and your fears are lessened, and that you can really hear the things that you need to hear and engage into the things that you need to engage in to make your lives overall better. So I hope that my tips help. And if you have any questions, don't hesitate to reach out to me. Thank you so much, and enjoy your shut-in. Enjoy your downtime.